Video 3 of 3. Brief examples demonstrating the consultation technique effectiveness. No actual names. Example 1 occurred in 2008. A 79-year-old that had been diagnosed with Alzheimer's-related dementia. She seemed to present with common short-term memory issues, paranoia, repetition in speech, etc. But additionally, she was very abrasive and confrontational towards her daughter. Additionally, she seemed plagued with a time frame memory ceiling of 1978. Although she had relocated to Arizona in 1985, she gave the year as 1978. Although her husband had passed away in 1992, again she gave the year as 1978. And while her granddaughter was born in 1994, she again gave the year as 1978. Following rerouting strategies by way of the consultation technique, she now responded that she had relocated to Arizona in 1983. She now indicated that her husband had passed away in the early 90s, and she now responded that her granddaughter had been born around 1995. Her speech also became less repetitious. She seemed calmer in general and indicated that she felt a lightness or tingling in her head, but did not know why. The following day, a duplication of the previous day's success arrived quickly and with a sense of familiarity as she then recalled our prior meeting. Of note, although concrete memory ceilings may not necessarily be common, any type, and no matter the flimsiness, provides for valuable targeting with the consultation technique. Example 2. Mr. Scalponi of the BBB Consultants series. A 75-year-old with an early to moderate stages of Alzheimer's related senility diagnosis. Although repetitious with speech, he was reserved but concerned as he indicated with, "It seems that with my apparent forgetfulness, that my memory is not what it once was, nor is my life." Upon the application with the consultation technique, his responses began to arrive quicker. He then initiated with a repeated inquiry, stopped in mid-sentence, and then with a momentary stare added, "I already asked that question. In fact, I believe that I have inquired as such on several occasions." Upon being asked how he felt, he responded with a sense of clarity, as if a fog has been removed, although it is hard to explain. He then inquired, "Why might that be?" Similar results arrived quickly the next day. Of note, although variably expressed, Mr. Scalponi's feeling of clarity as if a fog is lifted seems not uncommon. Example 3. An 81-year-old retired bookkeeper who was initially diagnosed as dyslexic and then with dementia. While seemingly lucid and intelligent, she became flustered with reading numbers, but not the alphabet. Upon initiating with the consultation technique, she was well able to manipulate her checkbook balance appropriately, but with a notable anxiety. Example 4. A 74-year-old stroke sufferer that, in addition with typical short-term memory issues, was now linearity challenged. She believed that her son was 54, which was correct, but that she was 47 years old. She also had issues with such things as the ordering of the days of the week and months of the year. Following the application of the consultation technique, she was able to list the days of the week and at least the initial months of the year appropriately, and flatly stated, "I have always been 20 years older than my son." Example 5. As per Michael Kane of BBB Consultants, a 68-year-old man who initially was treated for bipolar issues and now also early stage dementia. Initially, Michael seemed anxious and paranoid and quickly questioned with, "Who are you? What do you want?" Following the consultation technique, which targeted towards both bipolar and memory stability issues, Michael then became personable chuckled, and even relayed a joke. And per his brother, I even recognized an aspect of my brother, his playful personality, that has been absent for quite some time. Example 6. An 83-year-old in a nursing home with a dementia diagnosis, but which seemed rather advanced. She was alert, but with a focus that drifted within seconds. She believed that she was within her residential home, seemed to blend the present with the past within her limited focused time frame, and showed no concern with whatever wording she used, whether incorrect word selection, incorrect pronunciation, or simply slurred. Although her issues would normally be considered beyond consultation technique viability, a degree of success was achieved as she slightly improved her focus and seemed to reduce the blending of the distant past with the more recent past. Example 7. A 36-year-old car accident victim who suffered short-term memory issues plus a high degree of frustration and anger and with combative tendencies. The short of it is, following an extended number of consultation technique encounters, her family was able to transition her back home from a secured unit within a skilled nursing facility. Example 8. An 83-year-old acquaintance who suffered a debilitating stroke was hospitalized, then admitted within a psychiatric evaluation unit. During a visit with the acquaintance, a staff psychiatrist inquired about apparent dementia issues prior to the stroke. Upon replying that no dementia issues were previously observed, the doctor responded that such was impossible, as MRIs indicated the patient's frontal lobe was extremely atrophied. As such, this acquaintance was depicted within BBB Consultants as the only known individual who was seemingly able to naturally self-apply the consultation technique, at least prior to the debilitating stroke. Example 9. A 59-year-old woman suffered cardiac arrest while jogging and then received CPR following an undetermined number of minutes. Following hospitalization, therapy, and rehab, she was unable to show initiative, humor, and affect. However, other than a period encompassing the cardiac arrest, her memory seemed intact. Following the consultation technique, she was not only able to present with a happy demeanor, but initiate with a humorous story. Other than those instances where the disease had progressed beyond the consultation technique's application, over time, all continued to show improvement.